Bismillahirrahmanirrahim. Hi everyone. This video is about the fourth ACGME competency, which is professionalism. So let's talk briefly about it. So as you can imagine, defining professionalism is not always straightforward, and there are probably many definitions of it in the literature. One definition I like is the one that I quoted from MICSAP, the Medical Knowledge Self-Assessment Program by the ACP, is that professionalism in medicine is specifically characterized by the placement of the patient's interest above the physician's self-interest, which is a fiduciary or the trustworthy relationship. This part of the definition I personally see as part of the patient care and system-based practice, the other core competencies. And then it also involved professionalism, involved acquisition, maintenance, and expansion of specialized medical knowledge. And as you can imagine, this is also part of the other core competency, the medical knowledge and problem-based learning. And but also involved adherence to ethical principles and self-regulation of members and responsibilities, which might be considered as part of the communication skills. I brought that in because I personally believe that professionalism is probably the most important ACGME core competency in addition to patient care, but I believe it's actually involved the other, or at least part of the other core competencies as well. And other definition also is professionalism can be defined as a medical professionalism signifies a set of values, behaviors, and relationships that underpin the trust the public has in doctors, which is a definition by the Royal College of Physicians in 2005. Or you can just simply say it's basically performing what you are trained to do as physicians, as close to perfection as you can, whether you are being observed or not. So again, many definitions, but at the end of the day, it really involves a very wide spectrum of the profession of medicine. So the first sub-competency under professionalism is professional behavior. And I believe most of us, when they think of professionalism, they think of this sub-competency. So hopefully, by the end of residency, the medical resident should move from level 1 and be able to demonstrate professional behavior in routine situations, a day-to-day activity, to level 4 and 5, when the resident can recognize situations that may trigger professionalism lapses and intervene to prevent them in oneself and others. So basically, like some of these attributes might be, for example, altruism is, the resident really cares for his co-resident, for his patients, for co-workers. He has respect for others, all of those who work with him. Honor, integrity, ethical and moral standards always kept by the resident, accountability, excellence, duty, and digital professionalism, just to mention a few. So there's, of course, maybe a lot of expectations, but at the end of the day, I would say, if I want to summarize it, I would say really common sense. I advise you, the resident, to always, look and know your institutions and programs guidelines. For example, the dress code, and ask for that early on and get an idea about all the standards, because this differs really from program to program, from state to state, from city to city, from community to community. So it's very important to be familiar with the standards in your institutions and where you work. And then as for expectations, before you start, before the rotation, it's a good practice to ask for expectation if the expectation were not provided to you routinely, so that at least the program know that you're interested, and also for your own protection, so that you know what is expected from you, and you work towards fulfilling that, right? So, and ask when you are not sure. Always try to not to just go with the flow, and try to understand the environment of your institution, of your program, and if you're not sure about whether this is the right thing to do or not, always ask questions, especially at the beginning of the year. This is your time when you ask questions. The other sub-competency is ethical principles, which is basically the learning and teaching, hopefully at the end of the residency, be able to teach the medical ethics as well, right? So hopefully the resident will be able to move from level 1 when he or she can demonstrate knowledge of basic ethical principles to level 4 and 5, where the resident can analyze complex situations and engage with appropriate resources for managing and addressing ethical dilemmas as needed. I believe most of the programs will give some education and teaching about the four guiding, principles, the famous four: beneficence, non-maleficence, respect for patient autonomy, and justice. So hopefully you'll be more acquainted to all these four principles, as you get more and more training. And these ethical principles really involve a lot of concepts. For example, the physician-patient relationship, and what guides that relationship, and what controls that relationship. How to deal with challenging situations, the difficult patients. If you have a colleague who's not behaving well, or even some suspicious for substance use. Patient autonomy and decision-making capacity, patient who cannot make decisions, patient who has some issues with their relatives or family members. Patient with when there is medical errors, how to disclose these medical errors and whom to talk to, and from your institutions, and also whom to disclose and how to disclose these medical errors, and withholding or withdrawing treatment, for example, at the end of life situations. So all these are just examples of ethical principle that the resident is expected, hopefully by the end of the residency, to master. The other subcompetency is accountability and conscientiousness. And I don't know really why they picked this difficult word, but anyway, so hopefully the resident will be able to move from level 1 when he or she can perform administrative tasks and patient care responsibilities with prompting when they're being told to. They follow the instructions, to level 4 and 5 when they are proactively implement strategies to ensure that the needs of the patient, the team, and the systems are met. So, for example, basically the resident is really able to fulfill the programs, the hospitals, and the outpatients clinics requirement, for example. So, they complete the notes on time, they return the patient's call, they retain the nurse's call in the hospital, they return the emails from coordinators, from co-workers. They log in duty hours on time, they log in the procedures, etc., etc. So basically, just they're really accountable, and you can trust them to do these administrative work on time. So the last subcompetency under professionalism is knowledge of systemic and individual factors of well-being. Well-being is really becoming a big topic now in medicine overall. And intermedicine is not an exception. So hopefully the resident will be able to move from level 1 when they can recognize the importance of getting help when needed to address personal and professional well-being, to level 4 and 5 when the resident is able to reflect on actions in real time to proactively respond to the inherent emotional challenges of physician work, and can suggest potential solutions to institutional factors that affect well-being. Basically, they're playing part of the promotion of colleagues and physicians' well-being in their institutions. So, example might include sleep deprivation and understanding the factors around sleep deprivation. A lot of most all of the internal medicine programs, they do some education to the resident about that. It's really important. And coverage during illness or for family needs and scheduling issues. Hopefully there will be no hidden curriculum in any program that really kind of make the resident intimidated when they ask for coverage or for sick leave or something like that. So hopefully the programs will be supportive for that regard, and also the resident need to be aware of their needs as well. And their their rights, and to be able to maintain their well-being, and also access to food in the hospital, the call rooms being comfortable and accessible, in general just safe workplace environment, and they're able to promote that in their institutions. And then, of course, the psychological and emotional support to self and to colleagues, and to recognize signs of burnout. I think that's really important. Again, burnout is a very important topic, and hopefully most of the residents will be able to participate, for example, into the well-being committee if there's one in their institution, and if there's none, maybe they can start one. All right, so yeah, I mean, the program will be able to assess the resident professionalism in many ways, right? Including direct observation by faculty, by peers, coordinators, nurses, and staff, formal assessment forms or tools, critical incident report by the resident themselves, by the nurses, by the staff. And some program can do even objective structured clinical examination, or OSCE, to kind of evaluate the knowledge of the resident about burnout, for example, about their professional behavior, how to deal with difficult challenges, different patients, etc. The ACGME has a cool tool. It's called the Interprofessional Professionalism Assessment, or IPA instrument. You can look into it, or ask your program to look into it and see if that's something that your program is able to implement, to kind of accurately assess the professionalism of the resident. And by this, we only left with the last ACGME competency, which we will discuss in the next video.